We hope you enjoyed this e-case challenge and you've increased your knowledge and confidence in monitoring and managing patients with major depression. Major depressive disorder is common, and most depression is managed in primary care settings. One key to increasing the likelihood of antidepressant success is giving patients an adequate trial of antidepressant before switching. This encompasses the proper time at the proper dose. The goal is to get patients to an 8 to 12-week trial. To reach this, patients should receive an early check-in, even 3 days after treatment initiation, through a quick phone call or check-in, and then a couple of 2-week follow-ups to help you monitor and counsel regarding adverse events and efficacy. Setting patient expectations is also crucial. Generally, a patient should not expect a complete remission in 2 weeks. Similarly, there are expected side effects in the early period. In treating other conditions, we tell patients what to expect, and depression should be no different. Preventing an inadequate response is better than reacting to an inadequate response. This will help prevent many medication switches or patients giving up on care altogether. Monitoring is what will help determine if the patient is having no response, partial response, or a complete response. For certain patients with partial response, antidepressants can be augmented with the use of atypical antipsychotics such as aripiprazole, brexapiprazole, and olanzapine, and also antidepressants from other classes, lithium, and thyroid hormone. Through the COVID-19 epidemic, this disease has had long-reaching effects, even in depression and anxiety. Research has found that COVID-19 as a disease and societal stressor impacts the mood of individuals and can exacerbate existing depression as well as cause new depressive episodes. This seems to be related to isolation, but also to the interaction between inflammation and depression. Patients infected by SARS-CoV-2 have special concerns related to depression. Clinicians in all areas of medicine must be hypervigilant to assess the impact of COVID-19 on their patients' depressive symptoms. As with so many areas of medicine, personalized assessment is part of the treatment. Throughout all phases of diagnosis and treatment, collaborative care will help maintain the flow of your practice and treat patients more effectively. Remember to keep in contact with your area psychiatrist, lean on your nursing staff and other healthcare providers to check in and monitor patients' symptoms and side effects. Thank you again for your participation in this e-case challenge.